Hello guys, welcome back to your number one online show, Celebrity Facts Talk Show. Nakumbuka before tuendelee, hata finye hiyo red button iko hapo chini na ufinye bell, ndio tukiweka video ingine utapata. Leo tuko na these amazing people doing great work. Young men, nimerealize wanafanya kazi nzuri sana hapa nje. Niko na watu kutoka Physiotech Rehab Associates. Hiyo kusema hiyo word kusema hiyo word ni ngumu. Yeah, so karibuni sana Celebrity Facts Talk Show. Na niko glad sana kuwa na nyinyi huku leo kuongea maneno mengi. So tutaanza na introduction. At least mimi nawajua kiasi, at least nawajua na jina na what you do. You can just introduce yourself to the audience.
So mimi naitwa Bernard Kabwe. I'm a physiotherapist. I work with Physiotech Rehab Associates. I'm the founder and the current chief executive officer.
Okay. Now you?
Mimi naitwa
Amos. Okay.
And I work with Physiotech Rehab Associates. I'm the co-founder and then the head of clinical services in Physiotech Rehab.
Sababu nyinyi mmesoma medicine. Hakuna mchezo huku. So physiotherapy, unajua kuna watu sahii wanasikia wana watch na wajui physiotherapy ni nini. Hebu waeleze ni nini.
Hiyo swali ni poa sana. Watu wengi hawajui physiotherapy ni nini. And yet is a very critical medical approach yenye inatumika, which has been in existence from before around 1400 BC. So it has been there
before Christ.
Before Christ it has been there. Metamorphosing, becoming even much better.
Okay.
So physiotherapists, we usually say generally it's a medical profession whereby we are involved with assessment, planning and implementation of rehabilitative programs, and all these programs are aimed to restore or maximize human motor function, maximize mobility, and also relieve pain syndromes. Despite that, we are also involved in treatment and prevention of physical challenges that will arise as a result of injury, disease, or impairment. Physiotherapists also play a critical role in screening of disability and trying to mitigate them.
Okay. So as in it's a company, sindio?
Yeah,
so which services do you guys offer?
Okay, in physiotherapy, when daktari amesema we prevent, we treat, and then we still promote to prevent still the occurrence of the problem. So the prevention, we offer health programs, health promotion programs. When tunaenda kwa chama ama tunaenda kwa the people in the community, tunaongelesha kuhusu, for example, kama ni non-communicable diseases kama diabetes, badala ufikiwa kupata hiyo diabetes, how do you prevent? So we offer health programs to those people in the communities and those who are within our reach, to at least to promote the prevention of this disease. Now during the treatment, we tackle every system. The most rampant system mostly we tackle the musculoskeletal. Musculoskeletal ni muscle, bones na nerves. Zote ziko hapo.
Ziko kwa hiyo musculoskeletal.
Okay. So in the muscle, if there is muscle pain, for example kama ni lower back pain, kama ni kuna ugonjwa mwingine unaitwa fibromyalgia, muscle pain, just general muscle pain.
Sijaisikia lakini naisikia leo.
Yeah. So nile we deal with the muscle. Any problem with the muscle, is it injured? Is it pain? Is it anything? Then we go to the joint. Joint is the joint painful, either due to osteoarthritis, rheumatoid arthritis, all those. Then we go to the nerve. Nerve, the musculoskeletal, is the nerve injured, like imefinywa. Ikifinywa to represent with the pain. So generally in the musculoskeletal, it's all about pain. Now we go to geriatric. Geriatric ni wazee. Mtu akizeeka unaelewa, mtu akizeeka bones zinaanza kuwa weak, na hayuko active.
Naonanga wengi wanaanza kutembea hivi.
Now we deal with them, at least to make wakuwa very independent, to at least wasiende mbio. Still unaelewa, tulizaliwa, we have 3 phases, tunakuzaliwa, kuishi na kukufa. But hiyo kukufa si watu wengi wanaipenda. So with that, it's like we prolong the life expectancy of the old people. like to make wako very independent, free from any problems kama ni pain, kama ni ati mgongo nini something like that. Then from there tunaenda kwa watoto. Mtoto tunadili na yeye mwenye amezaliwa, kama amezaliwa akiwa na either of the problems, kama amezaliwa through CS, maybe amezaliwa through CS hii kawaida imekataa, anaweza kudevelop some of the problems, kama for example cerebral palsy. Kama mtoto time yake ya kugrow, kama ana grow pole inaitwa delayed milestones. Kama mtoto for example kama kwa 2 years na anapaswa kuwa anatembea, and by then hawezi kutembea, we as physiotherapists come there, alafu tunamfanya achieve the milestone. Then hata zingine na kwa watoto, kama ni mguu unaona watoto wanatembea hii mguu ikiwa imepinduka, inaitwa CTV, congenital.
Inakuanga ugonjwa hiyo.
Na kwa but ndio kwa congenital, mtoto amezaliwa nayo. So basically all problem with the child tunazitaka physical problems. Then from the child naenda kwa neurological.
Okay.
Neurological tuna deal with anything affecting brain, spinal cord, na any nerve coming from those two areas. For example, stroke in affected brain. Like affected brain una present with weakness, sometimes paralysis. So with that, we physiotherapists come in hand in hand with other medical professionals to at least to make this person to be independent before. When daktari alisema we restore function. Now that's the risk. Because before I was walking normally, I was talking like with you like this one, but now due to that stroke, I'm not able to do that. Now physiotherapy restore function. Kuna stroke, kuna multiple sclerosis, spinal cord injuries, all those. Then there are so many more disciplines in which physiotherapy work in. Kama in cancer, palliative care, oncology. Still our these terminal diseases. They need care, they need physiotherapists for that. And so many more disciplines in which we work in.
Niliona the services zimekuwa listed hapo kwa website. So watu wanaweza enda kwa website pia wacheck further the services zenye mnaoffer. Ilikuwa
www.physiotechrehabassociates.com.
Okay. Na sasa tuseme venye nyinyi ni physiotherapists, si ndio? So mmesoma medicine tu alafu mkaspecify huko ama ni aje?
So for you to be a physiotherapist, you must be very good in all the sciences and maths. You must secure yourself a slot in a medical school where you'll be trained if it's a BSc program for 4 years, if it's a diploma program for 3 years. Then from there you can decide to go into a specific specialty. You can decide to either into neuro rehabilitation. You can decide to go into musculoskeletal. You can decide to go into pediatrics, palliative care, and all those things. So there is a specialization after completion of your BSc program.
Oh, na sasa mtu ukikuja tuseme venye nyinyi ni physiotherapist, can you also treat these as other diseases? As in mnaweza offer services normal za daktari.
So what happens in a medical school, we are trained together with other clinicians, with the doctors, with the nurses. The module is the same. The only difference between us is we'll never have an invasive approach to the problem that you have. So we'll never do surgery on you, and we'll never prescribe medication for you. So we go on a physical approach. However, we are trained on pharmacology. You should be very good in pharmacology. You have to understand this patient comes with a certain drugs that he or she has been prescribed. You have to know what's the purpose of these drugs, because some of our intervention may go contrary to the condition that the patient is having, and that can be informed by the medication that the patients have. So we are also up to par in terms of pharmacology and medication.
Still to add on that, remember huku nje watu hawatujui kama physiotherapist, kama daktari. So mtu atakuja, mimi daktari niko naishi. So I as a doctor they refer us.
Utamsaidia.
Now I need to understand this condition, and then after understand it, I will able to know if I as a physiotherapist if I want to tackle, or it needs a doctor, or it needs a certain specialty. So daktari amesema we just train in one, it's like we train with other medical practitioners or the other models.
Then so you specialize on different things.
So with that we have the overview of all conditions, so that if patient comes to us, we know it is ours or it is for maybe a medical doctor or something.
Now, if I ask, as in what inspired you to start these Physiotech Associates? Ni firm ama ni company?
It's a company.
It's a company.
Yeah. And by the way, people should know now we have been certified as medical equipment distributors too.
Oh yeah, niliona kwa website.
Yeah, so
alafu nimeona mna nini hadi sub-Saharan. Ama nilikuwa nimeona nini.
Okay, so what happens? You have asked a very good question on what inspired us. We are going on our 3rd anniversary very soon for the company. And the reason as to why we decided to go on to this is we want to bring a new flavor in terms of approaches to what we do. You realize that most of the people are doing the traditional approach. We want to eliminate that in medicine. We want to have the patient as a partner in the treatment journey. We want to bring them together and feel them in our treatment. Let's understand their expectation. Let's understand their feelings, their traditions. Let's also bring our expertise. Let's also flavor it with evidence. Because in the treatment, you need to come up with evidence. What has been researched? What has been seen to work? That's what you want to incorporate in. It's very amusing to find out that currently, around 2.4 billion people, and this is according to the WHO, 2.4 billion people have a health condition that require the role of a physiotherapy or the approach of a physiotherapy. And these people, most of them are in the low income and mid-low income, like the developing countries, like Kenya. And you find that 50% of these people cannot be able to access the services of a physiotherapist in terms of treatment and rehabilitation. And with time, you realize that our services are increasing in demand because of changes in health dynamics and population dynamics. You find that, in fact, the WHO is saying by 2050, more people will be over 60 years because of increase in life expectancy. So who will serve these people? It's the physiotherapist.
Yeah.
So we need to be more empowered, and that's why we are coming here. Then you realize that most of the people in the rural areas cannot access the services. Why? Because most of the practitioners are concentrated in urban centers. So why don't we decentralize our services to rural areas, so that people can access our services efficiently? Then most of the people cannot afford the services of a physiotherapist. People will say physiotherapy is very expensive, of which I agree with them. So we need to subsidize, and that's what we are doing. We need to subsidize the services, make them affordable, reach out to the people. There is 4 ways you can get the services of a physiotherapist. 1 is the inpatient, 2 is the outpatient, 3 it's the walk-in clinic, and 4 it's the community levels. So I think our main objective is to ensure that we deal with these health issues at the community levels, and that includes what my colleague said in terms of treatment, prevention, and promotion. Because if you do promotion, which is awareness, it means people will not incur a lot of money in the treatment phase, and that's the uniqueness with us. And I think that's why most of the patients now are preferring us, because we give them that environment where you can discuss with us anything, you can tell us anything, you can have an ample space to talk your mind and speak out your mind.
Yeah, umejua uko rural area, sasa ka ushago naonanga shosha akiwa na shida kwa mgongo anakwambia sijui kuja unikanyagia hapa sijui aje. Hizo ndio mnadeal nazo.
So those are some of the services. Sasa kama yeye mwenyewe analia mgongo. Maybe
but sasa umejua hizi enda kuona physiotherapist juu ya pesa pia. Pesa ni shida.
So hii awareness yenye tuna creating tukifika hapo kwa community, wanajua kama ni mgongo inauma, kama nilikuwa natembea vizuri lakini in 2-3 days nimeinama sana, nikiinama mgongo imeanza kuuma, wanajua wanapaswa kuona physiotherapist. Still before ifiki hapo, wanajua kuna kitu unapasa haupasi kufanya ndio hiyo mgongo isianze kuuma. So it's like we are trying to prevent that. Na kama ime happen, now you know the person to go to physiotherapist. Yes.
So as in venye nimeona, meaning all of you wewe umesoma clinical medicine ama nyi wote physiotherapist.
Yes.
Wewe nilikuwa nimeona hapo, nini medical doctor pia kwa hapo kwa website, so mko na a medical doctor wa the company.
This is a multidisciplinary team in one company. Patient akikuja kwetu kama physiotherapist, tuna screen, tunajua this patient needs a medical clinician, as in a medical doctor. We refer him to the medical doctor in the Physiotech Rehab Associates.
So your company is a non-for-profit company ama
Okay, let's say what you are doing, we are trying to bridge both the profits and the non-profits, because we are trying to be in between in terms of we want to create awareness, and by creating awareness people cannot pay us. Right?
Yeah.
But coming for the treatment, then we will charge you. But what we are doing is ensuring there is fair charges that everybody will be able to afford and make sure that those services are closer to the people.
Okay. So nimeelewa. Mimi nilikuwa nashindwa. So like how do you guys create awareness? As in mnafanya aje? Kampuni kuna advertisements, ndio. So how do you guys create the awareness?
Kwanza create awareness kwa community, tunaanza where we live.
Yeah.
We start in Juda. We offer free services. It's like a camp, medical camp. Tuna advertise kwa gari, kwa hizo machama zenye nilikuwa nimekuambia kama watu wenye tunaelewa chama za mama.
So mna approach physically.
Yeah, tunawaambia we have a medical camp, ama pia tunapeana cards na tunawafikia. So that in that camp wanakuja wote in one place. We see them free of charge. Tunaona, tunawaambia this is a problem, ama tunawaambia now because this maybe is an indication you are going to develop, for example, osteoarthritis. You need to avoid this and that and that. Now tunawaambia vitu zote na maybe when you wanahitaji physiotherapy, tunawaonea hapo free of charge.
So for consultation ni free.
Very free. Still sometimes naenda tu kwa village sasa. Naenda hapo, sometimes we offer home to home. Yeah, we make sure we reach as many people as possible.
Okay, niliona you have a YouTube channel. So as in hiyo pia mnatumia kuelezea watu, kueducate watu, ama exactly what do you guys do?
Yeah, in fact, currently we have been into the limelight so much because we have done so many interviews with TV stations.
Pia isipoe mnaweza.
Yeah, we have done so many interviews with TV stations.
Okay.
We also do our own shows sometimes where we bring the experts and try to discuss these things.
Okay.
And then after every year we usually have a period of where we say give back to the community. So giving back to the community is, do you have a patient maybe who need our services and he cannot be able to afford? Then we come for one good week. We offer those services free of charge.
Oh, nika your CSR.
Yeah. So free of charge. Yeah, so that's how we try to link things up.
Oh, so you have a certain week penye mnaekanga, mna decide there is an offer.
Yeah.
Oh, the same to where we are. Nilisahau kuambia we are live at Rhapsody Cake and Coffee House. Na hii wiki umejua ni pizza week. Yeah. Meaning kuna 20% discount on every pizza price you buy. Kadi large, small ama nini. Then every Tuesdays and every Fridays you buy one pizza, you get one free. So mkiwa pale around Juja, then you are walking to the chamas ama nini, mnaweza order. Ukinunua medium unapata medium nyingine free. Kuna free deliveries. Yeah. So as in mshaikuwa na, you know, when you approach someone physically, like when you mnasema mnaenda kwa chamazi nini, mshaikuwa na any negative, as in mshaipata any negative influence, tuseme in that umeapproach mtu for the chama, unataka kuongea nao, alafu sasa mtu anakuambia tu sisi umejua hizo tufanyangi sijui nini vitu kama hizo.
In terms of treatment.
Okay, see in terms of treatment, like kupata hiyo chance ya kuongelesha. Si kuna wale wenye wanakuanga reluctant, wanasema sisi sijui Mungu ndiye ametuweka nini vitu kama hizo.
Hiyo kwanza tujapatana nayo. But ile yenye tumepatana nayo ni ile watu wanasema you are physiotherapist. Because okay, there are those people call it themselves physiotherapists, but they are not physiotherapists.
Oh.
Haya, wengine wanaenda kwa
So ni maconmen. Okay.
Then wengine wanaenda kwa masseurs au kwa massage therapist. Wanafikiria wameenda kwa physiotherapist because kumbuka mwisho iko na therapist.
So wanadhani ni same thing.
The same thing. Alafu the kind of treatment wanapata from there, unapata is like it's not to the standard. Wameenda hapo wametumia maybe pesa, alafu wanaenda home no change. So sisi kama physiotherapist tukifika hapo wanasema the same thing. Wanasema no. So that's one of the challenges tunapata na wao kwa village. Haya, wengine wako tu like wanasema mimi niko kwa nafanya tu hivi. Wanasema
kufanya exercise.
Physiotherapy exercise. So wanasema nikiumwa hii nafanya hivi. Nikifanya ile ni ile vitu kama hizo. Yeah.
Okay. Acha malize ndio tuendelee. Sawa, asante. So niko na hii swali, as in do you deliver your services as in indoor deliveries? Tuseme mimi niko kwa nyumba pale, nasikia naumwa ukweli na pengine siwezi fika penye mko, si ndio? Mnaweza kuja hadi penye niko.
Ukiangalia kwa hii bana huko chini imeandikwa inclusive of home-based care. Home-based care. Hiyo kwanza we try to cut off the expense of maybe coming from your place if it's far to our clinic. Maybe this is a stroke patient. It's not able to walk. It's not able to even you understand about incontinence. Maybe hizi mambo pamba hizi control na mweke kwa gari ni mzito. So tuna alleviate all that, tunaenda kumwonyesha. Basically tuna offer home-based care, very affordable.
Also wanalipia hiyo transport peke yake ama
So now when it comes to home based ina depend on the distance. Tunakuja kukuonea wapi?
Kani around Juja hiyo ni free.
Free of charge. What we want to do is making physiotherapy services affordable, accessible and effective. As easy as possible wherever you are. That's what we want and that's our aim. And now that goes ahead to include even in terms of mitigating disability and improving your quality of life in terms of prosthetic provision and orthotic provision. Yeah.
So naelewa. And tuseme mtu saa kwenye mtu anataka tuseme nataka ku ask for the services call ama nini, as in how can I reach you guys? Through the website ama through what?
So through websites, through our social media accounts, our numbers are everywhere, and through our email.
Okay. Oh, ile email unitumia.
Yeah, info at Physiotech Rehab Associates. So you can use that. You can book online. You can get us in all our social media accounts.
Book online for website?
Yeah, from the website. You just need to fill your name, your phone number, and the condition. There is a platform for that in our website, and we shall get it.
So in Facebook, ni Physiotech Rehab Associates. Ukienda hapo ukisearch Physiotech Rehab Associates itakuletea. Ukifinya kwa hiyo page unaweza enda kwa inbox. You reach hapo. Instagram the same, Physiotech at 101, Twitter Physiotech at 101, LinkedIn ni Physiotech Rehab Associates. Still numbers zetu
YouTube still.
Yeah,
YouTube pia.
Yeah. Ukienda ukifinya hapo utaona, ukifinya kwa the YouTube itself na Physiotech Rehab Associates utaona description na namba zetu.
Zitakuwa iko kwa in every video ama iko kwa channel?
Kwa channel, the description of the channel. Yes. Pia hata saa hii tunaweza waambia hapa.
Subscribe.
Subscribe.
Si ndio waende huko na subscribe ndio. At least you get more information about hizo bones and everything, the muscles and everything.
And they share with their parents.
Yeah, and you share with your parents.
Parents, guardians and old folks.
Sasa na umejua venye nilikuwa nasema, niliwauliza before tuanze hata hii rehab in this aspect ilikuwa inamaanisha nini. Umejua kuna ule mtu atakaa pale naone rehab. Umejua watu wengi wako na hiyo perception ya rehab ni msee ametumia drug, msee ameenda anafanyiwa hiyo medical process ndio aachane nayo.
So rehab is a short form of rehabilitation. So that's why we are calling ourselves Physiotherapy and Rehabilitation Company. So rehabilitation on this side, as my colleague had said, is from the time of identification of the problem to the time of fully recovery. However, we usually say rehabilitation is interventions which will bring about optimal functioning, mitigate disability, and also bring about social integration of a patient. Let's take this example. A certain patient has diabetic foot. The foot is amputated. So, as a physio, you need to rehabilitate this patient back to the society. So, how will you do it? You need to educate the patient first. You need a psychologist. Because you have psychological issues. You need an orthotic and prosthetic clinician who will come up with an artificial limb. As a physio, you need now to train this person on how to use that limb. Okay. You see? So that's the process. Until now, he becomes fully integrated to the society. And fully integration, it means this patient can be able to perform his work like before the problem has occurred. The patient is able to go into the educational activities. The patient is able now to attend family duties with more ease and comfort. So that's what you do. So you got a stroke. So we need to make sure that the area that you live in, your workplace, we can be able to fit you into your workplace. You can be able to be mobile. You can be able to raise your family and perform the activities just like before. And that's why we are telling the government, let the government come out. Rather than keeping on saying that you are giving the people living with disability a chance in the government positions, and you end up giving only one person, and we have so many people in the rural areas who are suffering because they cannot be able to access even the disability card and the privileges that comes with that. Why don't we make the environment favorable for these people? Why don't we have institutions where the people living with disability can be able to fit in effectively? Why don't we automate the doors? Why don't we have ramps? Why don't we give them prosthetics and subsidize the prosthetics that they have? Why don't we do just simple things? You know, one thing I have come to realize interacting with so many patients is the problem is not them, the problem is not the condition. The problem is the environment that is limiting. It's not the disability that's limiting, it's the environment that is limiting. And most of them are super talented. The government should just give them a chance and they'll see what does. Yeah, especially in subsidizing prosthetics. Let the government come clear that.
Hiyo nayo ni ukweli juu umejua msee, someone will say why should I look for the physiotherapy services and yet bado nafaa kununua unga, nafaa kufanya nini? So unapata imemfinyilia. But if subsidies ziko, then it will be more affordable.
True.
Yeah. Na sasa are you guys still students ama mshamaliza?
Senior luminaries.
Wewe nilikuwa na shida, how do you guys live in Juja?
So unajua Juja it's a strategic place. If you need to go to Western, you still go. If you want to go to
Thika,
it's still
Muranga.
Very accessible.
Yeah, it's accessible and it's strategic.
Okay, so venye tumemaliza, watu huko nje mwache kuwa ignorant on these muscle pains and joint pains. Look for these services, na venye tumesema they are so affordable, na mmesikia vizuri wako nadi wanaoffer these. Tumesema kuna subsidies on your services. Yeah, meaning it's affordable, sindio, na anybody can nini. So kama ni complaint unawochi, mzazi wako akicomplain, tafuta mzazi wako. Wewe ukisikia muscle pain, tafutana, na umesikia consultation ni free. Na umeona hapo ni
Physiotech Rehab Associates.
Okay, na mwende YouTube yao
Physiotech Rehab Associates.
Okay, Instagram
Physiotech 101.
Physiotech 101. Yes, mwende huko na subscribe, na pia mkumbuke kusubscribe huko kwetu. Thank you.